Hello, my name's Leslie Grimes. I'm one of the course unit leaders for the Cardiovascular Disease and Diabetes course unit. Welcome to the course unit. As you're probably aware, diabetes and cardiovascular disease are probably the most common long-term conditions that you'll encounter in your daily practice as a community pharmacist. And if you think about it, people with these conditions may see you much more often than any other healthcare professional. If we just think about some of the facts of diabetes, we know that in 2011 we have 2.9 million people diagnosed with diabetes in the UK, and it's estimated that this will rise to around 5 million by the year of 2025. A massive proportion of the population. And really what this equates to is about 3 people diagnosed with diabetes every 10 minutes in the UK. As we're aware, diabetes can lead to lots of complications. Diabetes and cardiovascular disease do in themselves come hand in hand. And cardiovascular disease can account for about 52% of fatalities in patients with type 2 diabetes. Other complications that we're aware of are renal disease. Renal disease accounts for 11% of deaths in type 2 diabetes. Eye disease. People with diabetes are 10 to 20 times more likely to lose their sight than a person who doesn't have diabetes. Other complications, neuropathy. About 50% of patients with diabetes have an element of neuropathy, and it's estimated that we conduct about 100 amputations every week in this country because of diabetes. Other things that impact on a patient's life are sexual dysfunction and also depression. People with diabetes are twice as likely to suffer with depression and have because of the reduced quality of life than a person without diabetes. So we can see that all these things have a massive impact on the patient. In addition to this, diabetes has a massive impact on the NHS. It's estimated that we spend about 10% of the NHS budget in managing patients with diabetes, and this equates to a staggering figure of £25 million every day. So if we look at this big picture, it does seem a little bit like doom and gloom, but it's not. If you think back to what I said before, in that patients with diabetes and cardiovascular disease are more likely to see you as a community pharmacist than any other healthcare professional, then there are massive opportunities for you to help patients with self-management, understanding their condition and the treatment, and also in making choices within their lifestyle to help reduce some of the complications that we've mentioned here. So what this module aims to do is to help develop your knowledge and understanding of the conditions, and also to help you develop your confidence and take a structured approach to deliver effective public health interventions with patients in this group. We really hope that you enjoy working through the course unit. As usual, you can find all our contact details on the course unit overview. We really look forward to supporting you through the course unit.